عليكم السلام.
Let us start. الو الو
يعطيك العافية
دكتور.
دكتور.
سامعيني؟ شايفين السلايدات؟
دكتور.
تمام. Can we start? Can we start?
دكتور تفضل.
Okay. Good morning. Today we will have the second lecture in microbiology among the MSS module regarding anaerobic organisms. We are going to talk about 3 organisms: Clostridium perfringens, Bacteroides fragilis, and the Trichinella spiralis. The objectives of this lecture are to study the morphology, pathogenesis, virulent factor, laboratory diagnosis, treatment, and the prevention of these 3 microorganisms. And then to understand the role of Clostridium perfringens and bacteroids in gas gangrene. There is a special clinical entity called gas gangrene. So what is the role of Clostridium perfringens and bacteroids in this condition? And also we are going to study the role of Trichinella, especially Trichinella spiralis, in muscle infection. And lastly, to study also the role of anaerobes in the formation of deep wound infection and abscess formation. So these are the themes of this lecture. Starting with the Clostridium perfringens, we have tackled Clostridium perfringens with food poisoning with the GI. But today we are going to talk about gas gangrene regarding the MSS. As we know, it's a gram-positive, non-motile, of square ends, مستطيلة الشكل, anaerobic, bacilli, spore forming. The spores are subterminal spores, and it has the capability of hemolyzing blood, so it is hemolytic. Microorganism can cause beta hemolysis on a blood agar. This microorganism, because it is anaerobic, it can grow in necrotic tissues, damaged tissue, with the production of hydrogen and CO2. That is the reason for gas formation. and it will lead to gas gangrene. باللغة العربية الغرغرينة أو الجنجرينة. Gas gangrene. This microorganism has got exotoxins, A to E, that is to say A, B, C, up to E. The most common one is the A exotoxin. This microorganism is present in the colon and in the soil, in the environment. The important exotoxins are the following: alpha, theta, and entero. Enterotoxins, you remember, we have talked about the enterotoxin in the GI and cause food poisoning, and this will lead to fluid and electrolyte loss. Alpha toxin, it affects the muscles. It is phospholipase. These alpha toxins are phospholipases, affect the cell membrane of the muscles. The theta toxin can affect the capillary and the heart and cause pore forming. يثقبها ثقوب, pore forming. Therefore, exotoxin are alpha, theta, entero. These are the gram-positive, rectangular in shape, spore forming. The spores are subterminal. Gram-positive microorganism, anaerobic microorganism. They don't require oxygen in their growth. This table shows the usual location of some of these anaerobes. The whole table is not wanted from you. I want from you only the microorganisms related to this lecture. So Clostridium gram-positive, present in the intestine, right? Bacteroides fragilis, gram-negative cocobacilli, present again in the intestine. The other microorganisms, you can look at them just for your information. But today we are dealing with 2 microorganisms only here in this table. The gram-positive microorganism, Clostridium perfringens, it's spore forming. It has alpha, theta, and enterotoxin present in the intestine, in the environment, and also in the food. As you know, it can cause food poisoning. This microorganism can lead to cellulitis, gas gangrene, as I mentioned in the beginning, enterocolitis, part of the food poisoning. Other microorganisms, histotoxic species similar to Clostridium perfringens, spore forming, present in the intestine, in the environment, can cause cellulitis and gas gangrene. So we have to keep in mind that there is a microorganism similar to Clostridium perfringens. I don't want you to know how we differentiate between them. It's only just for information. The gram-negative bacilli, Bacteroides fragilis, it is capsulated microorganism. Remember, Bacteroides fragilis, capsulated and gram-negative, while Clostridium perfringens, gram-positive. It can produce enterotoxin, present in the intestine. It can lead to abdominal abscesses, deep abscesses. Bacteroids in general are opportunistic microorganisms, also present in the intestine. So bacteroids in general, again, present in the intestine and are opportunistic microorganisms. The most important species is Bacteroides fragilis, which is capsulated microorganism. Clinical capsule, and I always say that we have to pay attention to the clinical capsule. Why? Because these modules are paraclinical items. So Clostridium perfringens produces wide range of wound and soft tissue infection, and also can produce food poisoning, as I mentioned. They act as if they are opportunistic bacteria. The most dangerous one, dreaded khatira, of these conditions is the gas gangrene. If you have wound infection, it can progress to shock and death in a few hours only, in matter of hours. As I said, the Clostridium perfringens can cause food poisoning, which is characterized by diarrhea without fever and vomiting. You have to remember that we mentioned this previously. What is gangrene? What is gas gangrene? It occurs with a traumatic wound. If you have wound caused by trauma, like for example fractures, bullet wound, accident, hacking, hacking يعني الصيد, traumatic wound, and there is a muscle damage, this will be a good environment for this microorganism to grow in. And we will see that in a moment. So the pathogenesis, this microorganism requires low redox. What is redox? Low oxygen tension, because we say this is anaerobic microorganism. The spores of this microorganism germinate, produce alpha toxin. We said alpha toxin affect the cell membrane of muscles, muscle bundles, and this can lead to local and systemic effects and shock. And we will see how shock will develop in a moment. The theta toxin contribute also to such an effect on tissue, and we said theta toxin can affect the capillary and the heart and cause pores in these tissues. You can look to the gas gangrene here. It is oedematus. This is the drug abuser patient. There are ulcers and the swelling related to the drug injection. And in the radiographs, you can see clear areas here around the infection and the swelling. These are gases. That is why we say this is gas gangrene. When you palpate the area, you will feel as if a crepitus under your hand, reflecting gases in the subcutaneous and deep tissues. Clinical case. Patient have accident, car accident, automobile accident, and has compound fracture. Compound fracture, that is to say, the bone open to the outside. The patient reached to the emergency unit, had surgery, and the wound debrided, yani cleaned, and then the fracture immobilized and given cephalothin intravenously per hours, 1 gram per 4 hours, cephalothin. Cephalothin, as you know, is one of the cephalosporin first generation antibiotic. The patient was in good health, except the fracture. He has no fever, and the hematocrit normal, white BC normal. And he stayed like that until the 4th day. Then he developed temperature, tachycardia, and the leg become very painful. He had a fracture, as we know, in the distal left tibia and fibula. That is to say, compound fracture in these areas, in the tibia and fibula. The cast was opened. شنو الكاس؟ يعني هذا الجبسونة، الجبس اللي يحطوه around the fracture. The cast was open and you can see that the area is swollen, reddish, with serosanguinous discharge, which is serous, as if it is a serum with blood, with foul smelling. A crepitation can be palpable due to gases. The blood pressure is quite low. That is why to say the patient become unstable, in shock. A gram stain has been done from the aspirate and found gram negative and gram positive. The gram negative, later on, we found it in culture as if it is E. coli, and the gram positive is the Clostridium perfringens. And the white BC has been increased, especially 85% polymorph nuclear leukocyte, indicating bacterial infection. The patient began on intravenous penicillin G and taken to the operation, to the surgery, and above knee amputation. Amputation يعني قطع الرجل فوق الركبة. Why? Because it is gangrenous. If you don't do that, the patient will die within a few hours only. So it's quite dangerous. This is the gas gangrene. This is the clinical scenario that we face sometimes in gas gangrene. I hope this clinical case will summarize to you what is gas gangrene. The clinical aspect of gangrene it can start within 1 to 4 days, and our patient in the 4th day started to have this manifestation. There will be pain, heaviness, then edema, tenderness in the area, pallor, then discoloration, hemorrhagic bullae. Remember, this microorganism is hemolytic microorganism. Late, you get gas crepitance and systemic manifestations that of fever and increase in the leukocytes, etc., and the patient will have a drop in blood pressure and shock. There is another condition called anaerobic cellulitis. You have seen in the beginning we said cellulitis. How we differentiate between anaerobic cellulitis and gas gangrene? A Clostridia infection of the wound and skin and subcutaneous tissue. In this cellulitis, there will be more gas production, but the patient have no pain, no swelling, and no toxicity. The manifestation, the general systemic manifestation, the patient does not have them and is much less serious than gas gangrene. So how we differentiate between cellulitis and gas gangrene? Systemic manifestations are absent. Pain, no swelling, no toxicity. It's also infection of the wound and subcutaneous tissue, but is much less serious, much less mild. It's a mild disease, this anaerobic cellulitis. Diagnosis, how we diagnose this condition? Clinical manifestation. Patients come to you with a history of a trauma. Also, isolation of the microorganism is adjunct, IVAFA, for the clinical diagnosis. We can do gram stain and we can do culture. Treatment excision, which is very important. Paramount, it means very important. You excise the wound, clean it from dead tissue, from damaged tissue. Otherwise, Clostridium can grow in this damaged tissue because it requires anaerobic condition. Then you can give massive doses of penicillin, as we said, penicillin G. Also, you can give cephalosporins, cephalothin, for example, which is very active against the gram-positive microorganism. First generation, as you know, is active against gram-positive microorganism and to lesser extent on a gram-negative. Also, you can give hyperbaric oxygen chamber. You can give hyperbaric oxygen. Why? Because the oxygen in high tension can kill the microorganism. This microorganism, as you know, does not want oxygen, is anaerobic. So if you give hyperbaric oxygen, oxygen in high tension, this can help in killing the microorganism. Any question until now regarding the Clostridium perfringens?
دكتور بدي اسالك هسه الهايبرباريك اكسجين ممكن يعفينا من الامبيوتيشن ولا لازم يعني اخر هذا توصل الامبيوتيشن؟
يعفينا من الايش؟
امبيوتيشن انه نقطع فوق الركبه، نقطع اجره.
لا هذا this is an extra الامبيوتيشن the leg was damaged already خلاص يعني if you don't do amputation the disease will progress upward, will go to the thigh and then to the pelvis and can kill the patient within a few hours if you don't do the amputation. Bacteroides fragilis is an opportunistic microorganism. Remember, these are opportunistic. They are present in the environment around us. In the intestine, we said both the Clostridium perfringens and Bacteroides are present in the intestine mainly, and also present in the environment. Gram-negative, capsulated. Remember, Bacteroides fragilis is capsulated gram-negative microorganism. Anaerobic, of course, can produce enzyme which is called superoxide dismutase, and we will see the role of this enzyme. It is an endogenous bacteria present in the intestinal flora, as I mentioned that. So you can see them, gram-negative bacilli, capsulated microorganisms. This microorganism, if infects deep tissues, especially in the abdomen, they can cause deep pain and tenderness anywhere below the diaphragm. So the infections that are caused by Bacteroides fragilis are below the diaphragm. Why? Because it is part of the intestinal flora. And the infection depends on the extent and spread of the microorganism infection. It can cause intra-abdominal abscesses with fever and acute abdomen manifestations. Acute abdomen manifestation, that is to say, abdomen will be tender and rigid. You cannot touch it deeply. Very painful. Pathogenesis of Bacteroides fragilis, it has relative oxygen tolerance, which can help survival. Is not, that is to say, is not strictly anaerobic. It is anaerobic, but relatively can tolerate some oxygen. The capsule of the microorganism, it has two capabilities. The first one is antiphagocytic, and we know always we say that the capsule is antiphagocytic, and also can lead to abscess formation. That is why Bacteroides fragilis is very important cause of deep abdominal abscesses. Remember, this microorganism can produce beta-lactamases. So if you are going to use antibiotics which has beta-lactam ring, you have to remember this microorganism is beta-lactamase or producers. And so you have to choose the antibiotics which are resistant to beta-lactamases. Regarding the immunity against this microorganism, anticapsular antibody plus the complement are very important in tackling this microorganism. Also, cell-mediated immunity is very important in protecting the body against this microorganism. So both a humoral with antibody and complement and cell-mediated immunity. Manifestations, the microorganism is not invasive. That is to say, it does not penetrate tissues. But if you have a trauma to the abdomen, you get peritonitis after a trauma or rupture of the intestine. If the intestine rupture for any reason, could be accident, could be bullet injury, trauma. And this microorganism also can lead to abscesses. And we said abscess formation is very important item in this microorganism because it is capsulated microorganism and can cause abdominal abscesses. Patient will have fever, tenderness in the abdomen, for example. And you have to remember when you have such manifestation that there are other anaerobic microorganisms which can cause such a disease, including Enterobacteriaceae. If you have rupture of the intestine, there are many microorganisms which are present in the intestine, including the Enterobacteriaceae, the enteric bacilli. Okay? Treatment, you have to use antibiotics which are active against anaerobes, anaerobic microorganism, like what? Clindamycin and metronidazole. Very important to know that the antibiotics that we can choose should be active against anaerobic microorganism. And as you know, clindamycin and metronidazole has these characteristics. Beta-lactam resistant antibiotic. Why we use such antibiotics? Because this microorganism is beta-lactamase producers. If you have abscesses in the abdomen, a drainage is the golden way of treating abscesses, a drainage of the abscess. Otherwise, it will stay. We finished with bacteroids. Now we will go to Trichinella spiralis. Any question regarding bacteroids? Clear? Okay. Trichinella spiralis. It is an intestinal parasite of a flesh-eating animal. Some animals can eat meat, can eat flesh. What are the flesh؟ يعني بقايا الذبح مثلا أو بقايا الحيوانات أجلكم الله الميتة. Flesh. Infection by Trichinella spiralis in a human is usually, generally speaking, subclinical without acute manifestations. The larvae migrate and go to the striated muscles, mainly. Also can go to the heart and CNS, but mainly in the striated muscles. Can cause an inflammation, result in infiltrate around the area, سواء بالمصل أو بالheart, with neutrophil, lymphocytes, and eosinophils. Also, specific antibody can be produced against Trichinella, IgG and IgM. And because it is parasite and present the larvae in the muscles or heart, there will be eosinophil destruction mechanisms against these larvae. Also, vasculitis can be produced. Why vasculitis? Because IgG, IgM can be produced against the antigens of Trichinella spiralis larvae, for example. So the antigens of the larvae with the antibodies can produce immune complexes. These immune complexes can result in vasculitis. You can see here that carnivores like pigs, الخنازير. carnivores معناتها الحيوانات آكلة اللحوم. Okay? Carnivores called. They eat the tissues which contains this Trichinella spiralis, and the larvae from cyst will be in the pigs, and then after that, if individuals, a human being, ingest the meat of the pigs, al-khanazir, lahm al-khanzir, which contains the encysted larvae. Encysted larvae, you can see it, the encysted larvae. That is to say, Trichinella ingested by the pigs or carnivores, whatever the carnivores are present, but mainly present in the pigs, and then go to the striated muscles. When a human being consumes the muscles of the pigs, it will go to the intestine, and from the intestine, it will migrate to the intestine and form adults and mate in the small intestine. And in the small intestine, larvae will be produced. And the larvae will migrate from the intestinal mucosa to enter into the circulation. And from the circulation, it will go to muscles. And you can see it here in the deltoid muscle mainly. And other types of muscles in the leg, gastrocnemius, for example, muscle. The larvae invade and form cysts in the skeletal muscle and in the heart, in the myocardium, and you can see it. So what we have cysts in the muscles, in the heart, sometimes even in the CNS. How they come? They come from eating muscles of carnivores. These larvae go to the intestine and then become adult and mate, produce a new larvae, which migrate from the intestine to the circulation and then to the muscles.
دكتور.
This is the life cycle of Trichinella. نعم.
دكتور في فار تحت، شو بيعمل هذا الفار؟
ايش؟
في تحت الخنزير في فار.
هذا carnivores، يعني هاي اللارفي موجودة in different tissues of animals. اللي هي مثلا الحيوانات اللي يعني مثلا عندك خنزير مصاب، وهالإصابة هذه قد تنتقل من حيوان إلى آخر. حيوانات أخرى مثلا rats, mouse, cats, dogs also may harbor the larvae because of eating the carnivores.
تمام دكتور.
Now, if we take biopsy from deltoid muscle, for example, or gastrocnemius, and if you put piece of the muscle on a slide, and then you put over it cover slip, تعرفون هذا الغطاء مال السلايد, it's called cover slip. This is and then you press on the cover slip. We call this squash prep, What is a prep? يعني preparation. You can see that spiral-shaped larvae are present. In staining tissue, you can see the larvae coiled like that. This is characteristic of a Trichinella spiralis larvae. Coiled larvae. We can see it in squash prep of deltoid muscle, of other muscles, and also coiled larvae from muscle digest. We clean the muscle, and then by staining, you can see the larvae coiled. Clinical manifestation of a Trichinella spiralis, larvae penetrate intestine, as I said, intestinal mucosa, and this can lead to abdominal pain and diarrhea. The symptoms, the general, we said the symptoms are mainly subclinical. The patient does not feel it. This depends on the number of the larvae or in the muscles, invasion. How many larvae will invade the muscles? If you get less than 10 larvae per gram, it will be symptomless. Above 100 larvae per gram, it will be symptomatic. If it is between 1,000 and 5,000 per gram, it will be very stormy and lethal, very dangerous. Complication, it can go to anywhere in the tissues. It may lead to eye swelling, may lead to conjunctival hemorrhage if it migrates to the eyes, may go and cause hemoptysis if they reach the lungs, and may lead to heart failure when they invade the myocardium, the muscles of the heart. Diagnosis of a Trichinella spiralis, as a parasite, it will lead to an increase in the eosinophil. So we get eosinophilia, that is to say, an increase of the eosinophil numbers in the peripheral blood and locally also. So you get in the peripheral blood 15 to 50% eosinophil, quite a lot. Also IgE will be formed, will be high as a parasite. Muscle enzymes will be elevated due to damage in the muscles. And we can detect antibodies. As we said, antibodies also can be formed of IgG and IgM class, which can be detected by immunofluorescence and ELISA, especially from the 3rd week on, لأن الأنتيبودي تحتاج فترة يلا تتكون، يعني أسبوعين، بالثالث تقدر تشوف الفحص. The best areas from where we can take a biopsy, the deltoid and gastrocnemius. This is the gastrocnemius muscle in the leg. You remember your anatomy. I have put it to you just to remind you. And you can see encysted larvae in this muscle area. Or from the 3rd week on, the larvae, when reach to the muscles, from the 3rd week will be encysted, will form a cyst. And we have mentioned that during my speech. The treatment is an inflammatory process in the muscles, in the heart, other areas, in the lungs, for example, CNS. So you can use corticosteroids just to decrease the inflammatory process in this area. In severe cases with edema, pulmonary infection, heart, CNS involvement, corticosteroids can be used. Also antiparasitic, anti-helminthic, ضد الديدان, mebendazole and albendazole. Trichinella spiralis is helminth, يعني نوع من أنواع الديدان. So mebendazole and albendazole can be used with caution. Why? Because sometime after destruction of the larvae in the muscles, it can lead to hypersensitivity due to the release of the antigens of the larvae during its destruction. How we prevent this condition? Follow feeding regulation of pigs. Pigs يعني الخنازير. And limit contact between domestic pigs and wild animals. Any wild animal. There are wild pigs also. Wild يعني البرية. And thorough cooking of meat is also an important just to destroy the larvae. By this, we end our lecture. Any question? Any question? Clear? It's a straightforward lecture. Just you can read it and find the important points which I have concentrated on. Okay? See you next lecture, inshallah.
يعطيك العافية دكتور.
يا هلا بكم. السلام عليكم.
وعليكم السلام.